From CBS 4 News, this is Facing South Florida with Jim DeFede.
Good morning and welcome to Facing South Florida. As more and more of the state and country reopens, we'll discuss what still needs to be done here in South Florida with Miami Beach Mayor Dan Gelber. And later, I will talk to the ACLU attorney who led the arguments in federal court last week to force the state of Florida to abide by Amendment 4 and restore voting rights of felons who have completed their sentences. But first, I asked Congressman Ted Deutch about whether we are ready to reopen.
We don't want to just leave the house. We want to do it safely, and we want to do it in a way that's going to allow a lot more opportunity for people who have been decimated economically as a result of this pandemic. And so that's my focus right now is as things start to slowly reopen, that we don't let up, that we continue to monitor, that if there is an outbreak, we can ratchet things down, and that there is planning in place to help keep everyone safe. The public health officials really need to have their voices heard in all of this, and that's what I've been really trying to do.
It's interesting. We've seen in the last few days a lot of attention being refocused on Dr. Fauci, criticizing him. Last night, I believe it was at the trifecta, Tucker Carlson, Hannity, and then Laura Ingraham back to back, just attacked Fauci all with the same line. We're now being led by a dictator. Nobody elected Dr. Fauci. Why is he in charge of deciding? It's like a new concerted attack on him.
Yeah, I don't understand. I mean, I do, I suppose, if we stop to look at that some of the decisions that were made by the administration all throughout January and February, downplaying the severity of this coronavirus, telling us that it would just go away when the spring came, that it's just like the flu, and then even more recently that if we can just consider injecting ourselves with some sort of disinfectant, we can make it go away. I understand that there may be some desire to try to take attention away from that, but there is nothing political about wanting to be sure that everyone in our state and our country is safe. And it's not one or the other. We can actually start to reopen the economy and do all the things that Dr. Fauci talked about to help keep us safe. He's not in charge. We know that that's the case. Dr. Fauci isn't the person who's making decisions about when things reopen. He's offering his expert opinion based on science about how to go about this in a way that doesn't lead to another outbreak. We only want this to succeed. Everyone. There is no one who wants another outbreak. There is no one who wants the economy to have to shut down completely as it did for all of these weeks. But let's keep both in mind. Let's talk about the real economic challenges that we have to meet, that Congress that's the reason that we're moving forward on the HEROES Act. Let's talk about meeting the needs of people who have been so impacted, and at the same time, talk about the importance of moving forward with public health decisions coming first. I do not understand the attacks on science and the attacks on public health officials. It is only done out of an attempt to try to divert attention. We'll have plenty of time to figure out all of the mistakes that were made at the beginning of this. Right now, we are all in this together. That's the way that I've operated. It's the way that we need to continue to operate.
Ron DeSantis says that he's actually got an oversupply of tests, that there are more tests available than people want to take them. I will tell you as well, I've had conversations with Jared Moskowitz, who has made a similar claim to me. He says that his testing sites that he set up are able to do, X thousand a day, and they're doing less than they can. Right. So they're saying that the ability for people to be tested is there. People just aren't coming out to be tested.
And they've ramped up testing, and there are a lot of sites now, and I give Director Moskowitz credit. I give the administration in Tallahassee credit for focusing on getting more testing, because that's what we need to do, and they understand that. The question is, what's the plan? It's no surprise, I don't think, Jim, that if you've been at home for 6 or 8 weeks and you feel okay, there's no urgency to go get a test. Just like contrast that with the very beginning of this in the middle of March when we went on stay-at-home orders, and everyone wanted to get tested because we were all so afraid. Well, it's not just a matter of having the test. There needs to be a plan. Who gets tested? When do they get tested? How do we make sure that that when we know that asymptomatic people can spread the disease, how do we make sure that employees who are forward-facing and talking to customers actually get tested so that we're certain that they're not going to spread it? It's, again, this isn't hard. We know it has to be done. And I'm not saying this in any sort of confrontational way. It just puzzles me that we're going forward. We don't have this plan in place yet. Everyone knows, every scientist you talk to, every public health official you talk to says, yes, we need testing and we need tracing. We need a plan to isolate people if they test positive. Let's just figure it out. We've been asking these questions of the state of Florida for weeks and received no answers at all. And the thing that's been so puzzling to me throughout all of this is the unwillingness on the part of some in Tallahassee to engage, to deal with those of us, and it's most of us, who only want to work together to help the economy move forward and to help save lives. That's the goal here. And the last thing I'll say is, we have this whole conversation. The most important part, the most important issue by far, is that we take care of the heroes in all this, the frontline workers, the doctors and nurses and hospital workers, and all of the people who too often, the people working in long-term care facilities who still today are being asked to wear N95 masks sometimes for a whole day, sometimes the same mask for a whole week, who are being asked. I talked to someone the other day at a long-term care facility who was told to wear a plastic bag because they didn't have enough gowns. That's not acceptable. Just want to explain, when we raise this issue, the answer that we'll get back is, well, we're doing everything pursuant to CDC guidelines. That's what you want. The problem is they're using the crisis guidelines for CDC, the ones that say, yes, when the emergency rooms are overwhelmed, then you have to do that. Well, we can't, on the one hand, say everything is great, there's plenty of PPE, and then turn around and say, but we're going to continue to use these crisis guidelines that requires doctors and nurses who are putting their lives at risk to wear the same mask day after day after day. That's what we're trying to get our arms around.
When we come back, Miami Beach Mayor Dan Gelber.